Your patience, everyone. We'll get there in a second.
And I can see live, so I think we're all good. I'll just hold on just a few more seconds to make sure the connection.
Okay. Yeah.
And you might have to be on mute at first just because of the slides, but then ready to go. So yeah, that sounds good. Thanks so much, Sophie, whenever you're ready.
Lovely. Okay, so welcome everybody, and hello to anyone who's watching live on YouTube as well. We are Coproduce Care, and we are doing this very differently to how you might have seen us do these live streams before. This live stream is concentrating on the report that we released a couple of weeks ago, which now has a web page. So if you want to go and have a look at it, it's www.coproducecare.com/report, and you can download our report. And what our report is on is whether staff within social care would take the COVID-19 vaccine. Now, it's really important to state that this was taken in November. So we have, there's a little bit of a lag, basically. So the results that we have were results that we closed the poll in pretty much the last day in November. We did some analysis and then we released our report at the beginning of this month. So it is only a couple of weeks old, but still, in the times that we're in and with information going so rapidly and changing so rapidly, things may have changed. So that's the caveat. But what we wanted to do is to just go through some of the results that we have. As you can see there on the slide, we completed the survey and we had 319 people respond to the survey, all working within social care, within different roles. And what we've got is a situation whereby we've tried to reflect as many different types of roles as possible. And so today, really, we're just going to go through that, and we have opened it up. So the reason it's slightly different is because we're actually streaming from Zoom. We're not streaming straight to our social media. So we're just getting around sort of operating the technology, which is actually quite easy for us anyway. We've kind of got our heads around it. I hope I haven't spoken too quickly, too soon, but it seems to be working okay. So you've got slides there. So we're going to have a discussion with people who have joined us on Zoom. If you've got the Eventbrite and you're watching on YouTube, but you actually want to get involved in the conversation and unmute yourself at some point, you can do that. You have to excuse my cough. It has nothing to do with COVID. But so, yeah, I'm just going to give a few couple opening words, and then I'm going to pass on to my colleague Arnie, who's going to talk through the report a bit more. He's going to put his slides back up, and he is going to just talk about some of the things that we have been discovering. And I think for us, the report wasn't just to say, well, there are the vaccine hesitancy within social care, the workforce, specifically on the workforce, is high, but also we didn't want to just give a figure. What we wanted to do was to actually explore what the reasons behind why people wanted to had this hesitancy and why they said they weren't going to take the vaccine. And it's actually quite revolutionary when you dig down into the data and you find people's reasons why they were quite hesitant to take the vaccine. And obviously, if you work in social care, you're quite familiar with the hesitancy there is with, for example, the flu vaccine. It can be a little bit of a task to get staff to take the flu vaccine. And actually, the hesitancy in the COVID-19 vaccine was slightly more. But it's not unusual to see this, and there's everything from not necessarily anti-vax, but just genuine concerns, which we'll go into a bit later, around will it interact with any of my medications that I'm having? Will I have what are the side effects, and just general information about what's in it, how it works, how long it lasts. A lot of the stuff that you've heard through, I mean, we're all very versed in this over the last couple of weeks, but it's not a sector that is anything particularly adverse to taking these things. There are just some genuine concerns. And I suppose what we wanted to highlight is that if we're able to, either within FAQs potentially, or just really good consultation within the sector with the workforce about how it works and how it can support people and how it can help people, if we can do good groundwork on that, which I know we're being encouraged to do by our public health officials, by our local authorities, if we could do more of that, then when it comes to taking the vaccine, it can be slicker, it can be quicker, and there can be a higher uptake within the sector, which is obviously what we want. So we are going to obviously present some of our recommendations and then hopefully open up to people talking about what they think would be a good idea. And we'd love to get your thoughts in the chat. I'll have a look at YouTube as well. But yeah, just whatever comes to mind, talk about, present your ideas. And obviously, if there's any good practice, then please do kind of explore that as well. I know that I've heard some really good success stories within, because obviously only a very small part of the care home sector is using it at the moment. So that's older people, and the care sector is so diverse and nuanced, but there's some really good examples of care managers being able to have that consultation with their staff, give the information that's available to them, and really at a personal level try and deal with any queries and getting good uptake. There's also a few comments that I've been hearing where it's not as successful, but there are some really good stories out there about some good success and uptake rates. So let's see how things pan out. But for the time being, we're just going to go through what we found, and of course share any other knowledge a bit later on. So I will put myself on mute and have a good old cough whilst Arnie goes through some of the themes that came up, and any other findings, and of course do put any comments or questions in the chat. Okay, over to you, Arnie.
Great, thanks so much. That's a really important introduction, both the times in which the survey ran, the sort of representation of who in the sector it means, and then the implications for what we've found, because obviously there are very important groups within social care sector in terms of who's receiving services, but also the workforce itself. But also they are a big chain. It's some of the first people that will get the vaccine. It's some of the people that we need to see sort of publicly engaging with it to encourage wider success afterwards. So absolutely, we ran the survey towards the end of November. We still managed to get quite a few hundred people join. And it was a simple survey. It was a little bit of details about the person. So we know that we had a good representation of a typical care worker, as well as different levels of seniority, which I think is important. We also found, asked just plainly, would you take the vaccine? Do you need more information? And then why? Gave some spaces to give that sort of qualitative explanation. From that, we got 4 clear themes that were really, really interesting and really, really relevant. You can see them on the screen there, but that is side effects, efficacy, age and existing health conditions, transparency and trust. And what this told us, behind the 41% that said no, at the current, as it stands currently at the end of November, I wouldn't take a vaccine. We know that that's not just, as Sophie said, it's not a conspiracy theory sort of anti-vaxxer idea. It is genuine concerns about what's in it, what is the process going to be of who gets it and why, and then how do we know how it will interact with anything else in terms of health conditions or medication that someone might already have over the next year if they take it. So very interesting. Lots of things about side effects. I might just say quickly, the 41% that we found is high. That definitely is high. It's higher than what the World Health Organization found in populations generally asking about vaccines. Now, this isn't sort of normal times and would you take a flu vaccine? This is, would you take a vaccine that's been turned around very quickly in non-normal times, unprecedented times, which I really didn't want to say. But still, we're comparing it to polls like YouGov, some of the surveying that The Guardian did, and some other sort of similar organisations like us, what we can see is that the social care sector does have a higher level of hesitancy than the general population in terms of a COVID vaccine. So a little bit more detail about the findings in terms of what people explained, why, what information they need, what they're concerned about now, and hopefully that will lead to a very productive conversation about how we can improve the way support and confidence is built in the care sector, the important care sector. In terms of side effects, the most common issue that people cited in the descriptions was side effects. How have we tested it? What is in this time to know how it's going to affect me? I've heard people have vaccines in the past and end up just getting the flu. I don't take the flu vaccine because I get the flu more often if I take it, those kind of things that we've all heard of. What's really, really interesting, in the next slide, we'll look a little bit more at how this thing stands now, what we've learned since, and what these lessons still mean. But sort of as it stands, there are no other side effects outside of sort of the fatigue that you would get, have a risk of getting following any kind of vaccine or inoculation. Efficacy, this is the kind of things like, once I've taken it, am I then safe? Do I have to be shielding? Do I have to shield if people around me are still at risk? How much am I now safe from the virus if I take this vaccine? Which again is obviously a really important concern. How often will I have to take it in the future? Is it now going to be an annual jab alongside the flu jab? And how much will it affect me if I've had symptoms recently, or am I sort of recovering from it and things like that? Age and existing health conditions, theme 3, is another really, really interesting and important one. So how will the vaccine affect me if I am older, if I have a condition that affects my immune system, if I'm already taking medication or taking some kind of treatment that could possibly interact with what is a mix of chemicals to try and fight off a future virus. Theme 4, transparency and trust. This is the less clinical one. This, I think, would exist in normal times. Obviously can't claim that fully, but this is about the systems around it. How in such a short amount of time has this vaccine been developed? How has it been tested? How is it now suddenly, at a time when we thought this could be running for years, and vaccines normally take a year to 2 years, like in prime absolute condition, how are we now 5 months on with the offer of a vaccine, if, especially considering that people's views on the way that systems to deal with a pandemic set up by our government might not have been particularly trust building in the past. That's a really interesting conversation in itself. So those are the themes. And yeah, just to sum up, really, it is a slightly higher hesitancy here that we found in the social care sector than general populations, but it is clear concerns there, real concerns that honestly need a good answer to really help build confidence and that support. Compare that to the wider literature, that is what you would expect. It's clear information about the specific concerns people have and making a visual, clear image of people taking the vaccine to sort of promote people thinking it's all okay and an important part to be part of. Now, if I just move on to the next slide, so you might join again, we'll have a look at, even in 2 weeks, what a different world it is to what it was when we finished this survey. So yeah, we've had new vaccines and new strains of the virus come into conversation, and we've had different news from how well it's being handed out to the systems behind the development and distribution, but also a lot of information coming out from the places you would hope to find it, that are breaking down the exact information we're going to talk about here, the exact sort of way to improve confidence and the likeliness that someone's going to take a vaccine is to give clear information specifically about their concerns. Do not belittle the idea that you would be hesitant about taking something like this. and then make it very visible that people are engaging with it. Sophie, I didn't know if you wanted to add another little bit about the state of things.
No, if we could move on to the next slide, if you've got one.
Right, so yeah, I'll just give us some up then. So people said side effects from the information that's coming out in the last few weeks. There aren't scary side effects. There isn't a huge risk that something is going to catch or make you feel worse. You're not going to get COVID because you've taken the virus. The only sort of warnings I've seen from researching is that if you're a kind of person who has had serious allergic reactions to different things in the past, or sort of surprise allergic reactions to things that you don't know you're allergic to, then like any medication, that is a risk. So if there's anything about allergies, you might have a reaction, but otherwise the worst people are reporting, like any other vaccine, is that there's usually nothing, but maybe some fatigue, a little bit of a headache, or just feeling a bit tired, which is similar to a lot of medication and vaccines. Efficacy, the process is 2 jabs. So as long as people do take the second jab in the time frame that's needed, and as sort of efficiently as they will have done in testing, then that's the process. Once you've had that, you're fine. If you've recently had COVID or been shown symptoms, then it's best to not have it straight away, I've been reading, and to obviously this information will come with the person administering it. But if you've recently had the vaccine, some form of infection related to COVID or a similar illness, then the vaccine itself won't take hold as effectively as believed. And also, even if you are completely vaccinated, you're not showing any symptoms, you can still infect others. So it is important to remember, or at least share the information with the people we're trying to improve the support and confidence around, is that even if you're fully vaccinated and you were sort of fairly confident anyway, or weren't too worried about your personal circumstances, you can still carry germs asymptomatically for a long time and pass them on to somebody who is vulnerable. So it will be important that we all understand the sort of communal nature of getting vaccinated, and a risk that still gets posed, just like the flu or any other illness that comes around each year. Very relevantly, that brings us to the next one. It hasn't been tested long enough to say whether it will be once and you're done, or this will become a sort of annual jab, at least until the system is complete, the sort of situation is much more under control and it's not affecting all our lives so much. Great, yeah, age and existing health conditions was the next theme. And from reading the information that has been developed in the last couple of weeks, they're going to older people first. That suggests more of a risk to the virus than anything else. But then pregnant women, people that are shielding and the clinically vulnerable, not actually given that information, because in my personal opinion, the testing's not there yet. So they might want to be seeing how tests on those groups go before it goes out. But we don't know. The point is, anything that's pre-existing in sort of general testing, there's not a rule that says if you have this, if you have a certain condition, then the vaccine won't work or it will react badly with it. Obviously, consult your GP. The person that's administering the vaccine should have all this information too. This isn't advice for someone to take the vaccine. This is the information that's existed. And obviously, people's health conditions are a very, very personal and individual basis. But that interaction with existing health conditions and age, there hasn't really been issues in the sort of testing of a vaccine rollout, relevant tests. And then moving on to the general testing, trust, transparency in the system behind it. It has been tested as much as any other vaccine would be tested. People saying, how has it developed so quickly? I think personally that's because of the scale of the situation we're in. Anyone that's in that world has been very aware of what their job is for the last few months. And now the tests have gone. It has worked on people. The efficacy of the vaccine is there. The issues have been highlighted. And it's all about the confidence now. It's all about getting this information out to the places in the format, in the way that's going to really make people feel confident and feel positive about taking part in what's such an important thing for our communities. Great, so if I had any sort of final lessons from our report and the wider reading that we've done to try and understand what will improve things, is all of these FAQs that are coming out now break down misinformation. As we're saying, they're really, really honest, very, very important and real concerns that people have. But now frequently asked question sites are coming out. Age UK, the British Heart Foundation have really, really nice sort of plain speaking ones. They're not quite easy to read, but the answers to all these questions: how long am I vaccinated for? What risk do I have with certain conditions? How should I shield, or how do my circumstances affect how the vaccine will work for me? That's all written out there. So even if you don't want to just share around NHS and more public health kind of guidance, there are really nice FAQs out there. So just make that information available to care workers, the groups around you, your peers, the people that you're hopefully working with to improve this rollout. Point 2, I've said it a couple of times there, Sophie said it right out at the start, it's a really important thing. This isn't all about anti-vaxxers or conspiracy theories or sort of a political group that is trying to sow distrust in governments and things like that. I'm sure that does exist in some places of the internet, but what has also been found is that general hesitancy also exists on a more general level across a population. So this isn't conspiracy theories, this isn't, oh, I don't trust this, I don't trust that because of messaging or something they've been told. These are genuine concerns. It's happened very quickly. It's a time when our health is very much at the forefront of our minds. And we're at a very uncertain time globally. So, of course, take the issues seriously, take the concerns with a lot of respect, and really honestly try and help people understand that this information is now here. And finally, just a little one, I think we can go on without asking, stay with us in the new year, across Christmas and New Year. We'll definitely be carrying on this work, and that will be a little bit of collecting these resources, making them easier to find, sort of trying to work with people to practice some of this, some of these ideas of getting the information to the right people in the right way, in the right format, and how does that improve the confidence and support. And then we want to carry this out more. This isn't going away. The vaccination process and care's role in it is not going away. It's going to be a huge part of next year. So we can carry on these conversations. We can scale it up. We can start looking at how it might be different for certain demographic groups within the workforce and the people we provide services to, whether that be age, ethnicity, what sort of part of town you're from, rural or urban kind of care settings, and all that. So definitely stay tuned and try and help us carry this work on over the next year. So yeah, plan there for discussion next.
Thanks, Arnie. I wonder if it'd be helpful also to talk a little bit about who the report covered. And I can sort of our report, obviously people can download it and look into more detail, but I wouldn't mind running over very quickly the recommendations and who it covered and some of the graphs that we have in the report. And I can share my screen, or you could just kind of, I could actually share my screen actually on this one, and then just kind of briefly go over to give people a flavour of who was involved before we go on to the next stage. Does that seem like something that might be an idea to do?
Absolutely, yeah. I've also got a report here myself. I can share if needed.
Let me give that a go. So hopefully people can see that.
Excellent. Oh yeah, that's much better. It's quite difficult to share once I'm doing bits in the background too. Absolutely, this is a really important point. The sort of split of who within our respondents, where they work in care, what level of seniority they are, is a huge part of this. That's the main graph. You can see at the start. It's across the different types of care provision, nursing homes, more conventional care and support, or occupational therapists in a more NHS-based role, and the community care that you find. There's a spread across those, but then also care and support, coordination, and senior management have a similar level of representation. So it breaks down to, I haven't got the numbers right there in front of me, but it is very, very close to half and half if you looked at care and support and senior management. Majority of respondents, 89%, identified as women, and the most popular age groups were 45 to 54 and 55 to 64. As the report goes on to say there, according to Skills for Care's reports on the workforce, that is very, very in line with a sort of quote unquote typical care worker at all levels again, in terms of sort of disability and where in the country they're based. We have a good representation. We did not reach enough people who are non-white, people that identify as Black, Asian, or any other ethnicity. We didn't get enough people to join the survey to give sort of significant analysis into how these issues or concerns differ among groups, which could be a huge part of that larger work in the new year that I think will be an important part. But yeah, like a lot of care, it's sort of middle-aged women that make a huge part of the workforce and have been a majority of our survey, which helps our representation. What Sophie's running through there is a bit of the wider literature which explains that difference between what might be like anti-vaxxer, conspiracy theory, political group, and a general level of hesitancy that exists in populations anyway. Absolutely. We're on now to side effects. Maybe we just want to jump, yeah, great, jump down to the recommendations. The report at that section breaks down the quotes and the actual data that we received on which we made claims about these are the concerns people have and these are the things that would help improve support.
I also want to cover what I thought was quite interesting, and that's about transparency and trust. So, you know, we did have a couple of people saying, well, there's been so many hiccups along the way with the way that the vaccines and the government has sort of supported or not supported the social care sector. That wasn't a huge theme, but it did come up in terms of building that trust in a sector which has seen a variable amount of support amongst it. So that's maybe a sort of lessons learned. And then some of the quotes here, just going through that again, unpicking the idea about trust that Arnie, you've already talked about. And people just needing more assurance. So those FAQs that I think are being developed, and some of them are out already, and I will share a link where people who need some more information about care staff, for their care staff, they can access that. That's on the government's website now. So hopefully all of that will be dealt with by now. So I'm just going to whiz through down to the recommendations. And that's what Arnie was talking about. So obviously this is very high level. It's very kind of a rapid response to this survey that we've done. But we have kind of picked out some things that we thought might be helpful for people to look at in terms of what information does the care staff need, what's useful for them. And one of those things is in our sort of the first recommendation around, you know, the side effects. Will people need to self-isolate? So I feel like some of these questions have been answered now or are going to be answered, but not all of them. And considering that if there is still quite a bit of hesitancy in this sector, it is going to hit certain groups and populations quite significantly. I also talked about the kind of the gendered nature of social care. Also in some areas, London, for example, there are pockets where there's a high percentage of people of colour who work in the social care sector, and actually dealing with their specific concerns in terms of sickle cell anemia, for example, might be prevalent in some groups, and people wanted to just know those specific answers to those specific questions, which is out there sometimes if you look really hard enough, but it's not really hitting most of the main comms at the moment. So that's something that to be wary of in terms of uptake going forward. We've also talked about further consultation. So, around doing this, what are the reasons behind it? Are there still some high hesitancies or not? But also directing that consultation at the different communities, and if there are specific groups, to find out how and why they are hesitant, and just local support, really useful, supporting local adult social care teams to get that information out in a way that will support people. I think maybe some of the things that I've explored in other reports and research that I've been involved with, enabling them to have the resources to have more sessions like this, but within their local area with local groups where people can ask questions and get them answered maybe by public health. That is really helpful. And obviously that won't apply to all organizations who already have a high uptake, but for those who are still struggling, that may just get more people across the line and confident in taking any vaccine that might be offered at the time. Is there anything else you wanted to mention about that?
That was a really good summary of the recommendations. The only thing I'd add is that a lot of this information has come out in the last couple of weeks. As I said, things like even the sort of Age UK, British Heart Foundation, that might have information that's a little bit more tailored to the kind of people you provide services to. That information still existed before. We knew generally what a vaccine was, what the process was of how it was being made. We had transparent information about testing phases, and that explains why it's here so quickly and things like that. The only thing I'd add is the local support is so important. The existing sort of knowledge about vaccines and hesitancy is this, so that very clear information comes out that tackles sort of general concerns. Excuse me. And also that peers need to be seen to sort of be taking it and not afraid of it, which is why you'll see maybe some politicians and members of the public having their vaccination put on the TV and shared around lots and lots. But considering we're talking about how we can support the care sector, we need to be thinking about what are our local leaders, who are people we trust sort of locally, to give us information and say, no, this is an important process. Here's the facts behind it, and here's why you should be getting involved and how. And it will just help. It will just help build that confidence. It will help people feel much more comfortable saying yes, telling others to say yes, and tackling those things which, under any government, people would have huge concerns about.
Okay, that seems really, I think we've covered most things there. So now we'll sort of open up to anyone who has mentioned anything on the Zoom, and I don't think that I can see too much in there's a little bit in the chat. I think, was it, I can't see there, for Azar had something they wanted to mention about alternatives. Now, that's not something we've covered in our research, alternatives. So we are sticking on vaccination, but did you want to ask about alternatives? Happy for you to unmute yourself.
Hello, hi, I'm Azza from Brighton. In just the discussion about the vaccination, I think amongst the conversation I've had with other managers and staff are the alternatives to people who perhaps cannot take the vaccination. There are many different reasons why people do not trust the vaccination. One of them is because it's so new and people don't know what the side effects are and who it's done for. Recently, we also heard from the local hospital about the research trial that they're doing to do with the anti-malarial tablets. And I understand that this research is also going nationwide, and let's look at how this anti-malarial tablet can be used to prevent people getting COVID-19. And if it's a medication that's also for the same purpose, which is to prevent getting COVID-19, it's a medication that's been around for a lot longer and that's been perhaps more trusted, and perhaps people can also have the choice of looking at how they can prevent themselves from getting it. Obviously, it's not the same as vaccination, but it's also another method of getting the staff equipped so that they don't pass on the infection. And I think the other important matter also to highlight is the fact that there's been so much more information recently, and in fact, actually for our area, the information only came out around the 8th of December to care staff to be cascaded down. So many people are still trying to understand the information about the vaccination and medication that's found before they make up their mind about it.
Just out of interest, Azar, is that what organisation are you registered nurse? Did you say RMN? And it's a care organisation. And you're also chair of Skills for Care Sussex. I'm just reading your message in the chat. So yeah, that's really interesting that you brought all of that up. My immediate thought, I mean, this is kind of just like a discussion area. Obviously, we're not experts in any of the detail, but it's kind of discussing other, it's a good question. What about alternatives? It's not something that we actually covered in our report. It's not something that people talked about. But I think from my perspective, I think it would be something you'd want to be very wary of, because as Arnie mentioned, for this specific vaccine, there's been so much support for it and so much resource plugged into it. I mean, classically, any type of research like this takes time. It takes ethical approval itself can take years, and even politically, financially, you can get quite a lot of barriers to it. But this had the whole world pulling together, so it's quite unique. I think trying other things and promoting other methods would be really risky at this stage. But I think it obviously this has gone through the regulator to be verified. The latest one that we've got at the moment that's being rolled out. So I presume that any alternatives would have to go through exactly the same measures for that to be taken up. So I can't really see anything else really taking on unless it's been verified by the regulator. But it is interesting to see what alternatives there are out there, but I would be surprised if you'd have any managers sort of promoting anything other than what's been verified. But I don't know if Arnie, you want to had any other thoughts, and then maybe we'll come back to you, Azar.
Yeah, it's definitely interesting. I would be interested to hear if it's something staff have talked about as well, and sort of, is that something they'd feel more confident with, or the sort of information around that, but how they feel about it. But yeah, as it stands now, all the work and all the information is around the vaccine. I don't think the systems behind it, considering the amount of work to follow sort of recommendations of all the transparency of sort of the process of us developing a vaccine, it being very famous, and sort of the need for that to be a big public conversation, clear information. Here's the vaccine, here's the process, here's what's behind it. I think that's the important thing for the next few weeks, and having those discussions would be a really interesting part of it. But yeah, let's like, where did it come from? Have staff been talking about this, or how are people in your area sort of reacting to the rollout?
I think this is kind of what makes it interesting, because we're talking about how people are not 100% of people, everyone, including social care staff. You would think that everybody would be jumping up for the fact that there is a solution, and And I think, you've covered in your research about the question of efficacy and trust. And I think trust is kind of one important thing, people just don't want to kind of believe about something that's just been kind of offered with no alternatives for the thing. It's about having that choice. And I think having that choice, I think what I think is most important is how do we get everyone, especially in the social care sector, to kind of take up the vaccination. And I think having that information accessible and having that clear and just to make them feel that they can trust the information, or kind of even the loudest voice that's coming from the government and from the community. But if they don't have anything to compare it with, and I think this is kind of where, as a care home manager, and I'm also, I think, echoing what a lot of my managers colleagues are saying, how do we make sure that our care home staff agree to this? It's not something that we can force on them. It's not mandatory, but we have obviously a greater advantage in order to get everybody to cooperate. But how do we do that?
I think this is a really good point. How do we get people to, how do we increase that confidence? And there have been discussions that I've been on lately around, well, should it be mandatory? Should there be a clause in people's employment contracts to say if they aren't taking the vaccine, then that's a manager asking someone to take the vaccine is a reasonable management request. Therefore, should they go down disciplinary routes? And I think that has to be an absolute extreme situation to go down that route, because actually what you're asking people to do is it is a very unusual circumstance. It's not a reason. I think any court would say it would be unreasonable to go down that route straight away without at least first finding out why the person doesn't want to take it, what support they need. And what our research has revealed, that when you actually ask people what is behind your decision not to take the vaccine, there's usually questions that probably could be answered. So I think taking that extra time to find out the reasons behind it, and also being aware as a manager that people will have different circumstances. So if you go down the disciplinary route for some people, but then you have other people who have medical conditions or are pregnant or breastfeeding and they can't take it for other reasons, then you're not going to be able to treat everyone the same way. And then you might have further issues further down the line. Then there's other things providers have been talking about. Well, what about my insurance? If I've got staff who won't take it, which means that clients are at a higher risk, does that affect my insurance? So I think there are a lot more questions than there are answers, I think. And that does add to the worry. And I think that will come further down the line as it gets rolled out to more services that aren't strictly dealing with the most at-risk people within social care, especially with maybe people who are in supported living or home care who are under the age of 80 that we're supporting. And staff feel like there isn't so much of an urgency to take it and they're worried themselves. Excuse me. So yeah, I think it's a really good question to think, what do we do? How do we help people to take it? But I mean, it has to be more of a dialogue, at least to start with, rather than going down any punitive routes. And also discussions like, if people could do more of this within their own local areas, encourage their directors of public health to maybe get involved, or their public Health England colleagues to get involved. That's something that we run locally in our area. I run a call every other week that gets those professionals involved, and providers come on the call and we ask questions like that. And you come away with links. I've put a link in about where you can find information from the government on the vaccine for care staff. I think most people know that now, but also if you dig a bit further, there's something, I think it's called a green book, where it's got more information about the vaccine, but not everybody would have automatically seen that link. And sharing that deals with a lot of the questions that people have. So I actually think that more discussion between local areas and staff and managers, just to highlight those issues, really is a good starting point. But I don't know if anybody else has any other questions or queries to add. Do feel free to unmute yourself or ask in the chats. And Arnie, while people are thinking, maybe do you have any other thoughts on what Azara's just mentioned or what I've just said?
Yeah, 100%. It's really tricky to think about sort of enforcing it in disciplinary action and things, because there are genuine reasons why some people will not need to take the vaccine or take the vaccine when it's their turn. In terms of those lists of the groups and stages of rollout, because if there's even sort of pregnancy, there's questions there. You making someone sort of under a lot of pressure if you're identifying them among others, and you're making the whole sort of process a little bit less friendly. If it was me in that situation, what I think is going to be really useful for staff within organisations is if the care managers, are absolutely making that information available. Here it is, let's just talk. You're concerned about this, here's the information we've got. It's not everything, but it's as much as we need, and it's proof, and it helps your concerns. But also just seeing those senior levels of staff, seeing a couple members of the support and care teams, just saying, I've had the vaccine, I'm okay. It's an important part of being a part of the sector this year. Then that it suggests, from what we've found, is going to be really effective in getting people to feel confident about it. Seeing peers and colleagues sort of happy and confident too.
I think another important factor that we haven't touched on is, I think it's about the practicality of having the vaccination. We're talking about a segment of society, a segment of the workforce who are often on a very low wage bracket. And I think we are kind of the privileged people in the industry who can afford laptops so that we can engage in webinars like this. We can have easy access to communication by emails. And you mentioned about the take up of the survey when there's quite not enough participants from the BAME community. And I think a lot of it is to do with the access to digital technology, the knowledge in digital technology. And going back to that also, for example, not every social care staff would have a laptop that they can use at home in order to kind of participate or kind of find out information about this. Some of them totally rely on the information from their care managers. And as we all know, many care managers are bombarded with emails, and sometimes not all information are cascaded through down to people, everyone in the care sector. And things like, how do they get to the vaccination centers? How long will it take them? And this is just a couple of weeks before Christmas. People are working all the hours under the sun, trying to cover shifts. How are they going to try to fit that in? And if they are going to go to two vaccination process, how many hours would that mean for them to lose out unpaid? And that is when it's kind of income that they really need around Christmas and New Year. This could be the factors why people are kind of thinking that I don't have time for vaccination because it's far more important for me to put food on the table.
Really interesting, hugely important point. There is existing literature that it points to exactly what you're saying. The World Health Organization quite sort of neutrally, or sort of a little bit distantly, trying to describe it as marginalization. So the groups that are more marginalized are more likely to have this sort of overall hesitancy. From what they say, I agree with you. It's exactly these issues. I don't live near it. It's a much bigger thing for me to take a day off and go across the region to get to the place where I have to be and back. The uncertainty of what that means for my work for the next couple days. These are hugely important questions for frontline care workers. Two, in our survey, we had equal representation of senior management and care and support teams. What that tells us, especially when we looked just at the senior management answers and just at the care and support work answers, is they showed the same level of hesitancy and they were concerned about the same things. So 100%, those are really, really important points. Considering that with the people around you is going to be huge in helping to get more people to take it, but also let's not start sort of, I don't know, making assumptions about sort of the way marginalised people act or what marginalisation means, because it's obviously a very, very diverse thing. And I think this is an issue with existing literature. It definitely might start seeing the world in that way, as marginalised and not marginalised, which is a really tricky way to see the world.
And I think it's also good to point out that today's report from the Royal Society of Public Health found that it's people of colour, so their words, minority ethnic people from minority ethnic backgrounds were less likely to take the vaccine. So it was 57% from what they call BAME backgrounds were hesitant to take the vaccine, compared to 49%. Oh, sorry, who would take it, compared to 49% of white respondents who are happy to take the vaccine. But on the other side of that, 35% would take it if, or were likely to change their minds if their GP was giving them more information. So that's from BAME respondents, compared to 18% of white people who responded who would change their minds. So actually, a lot of the evidence is going towards saying if there is local information, if there is local support, then people who you just talked about, Arnie, who are maybe marginalized or from communities of color, more likely to take vaccines, more likely to go back to what our report highlighted around the trust issue. If there is local information from a trusted individual that is accessible, going back to your point as well, about having information that's accessible to people and reaching out to those groups. So it's all kind of saying the same things, which is really promising, because if you've got a problem like this, you really do want an answer, and this seems to be going in the right direction. So I think that's really the main comments on that. And yeah, really, really helpful comments, really helpful thoughts. I can't see anything else coming out on the chat, Arnie. I don't think if you can see anything.
The only last couple comments I've seen are relevant. There's a bit of discussion of non-white groups and reasons why they might have certain concerns. I agree. Again, yeah, like the concerns are real, and in groups that the concerns are higher, the concerns are more true as well, and more affecting. So the point is, the vaccine is important. The vaccine won't discriminate. The circumstances in our society will discriminate. So let's make sure then that the information going to those groups is as useful for them as possible. It deals with concerns directly. It makes them feel as comfortable and a part of a system that's getting vaccinated alongside them too. But I'm also just aware of the time. Absolutely. Yeah, that's an hour then, and we've run out of comments and questions to go through. I'll just take one more minute and just say thank you to everyone who's joined, who's sent in questions, who sent in a comment. This discussion is a hugely important thing, not only for sort of this event, but the way we work and try and improve the opportunities for people in social care, both sides of that. So thanks very much. Try and stay tuned. We're at CoProCare online anywhere, any of your platforms, that's where you'll find us. You can also email us at hi@coproducecare.com. So I'll just share the title card so you've got those contact details And hopefully, if this has spurred on some ideas, or you just want to talk about these a bit more as well, absolutely get in touch, and let's make this a large bit of thing that helps everyone over the next few months. So have a wonderful Christmas and New Year, everyone. Thanks so much, and I'll see you soon once this title card's here.
Thank you very much. This is a really, really good webinar to have to encourage discussion. Thank you.
Great. Thank you for joining. Take care. Bye-bye.
Bye.